Testosterone as a hormone is part of a group of hormones called androgens, which are frequently referred to as steroids or anabolic steroids. Testosterone is crucial for the general health and well-being of males, impacting different body systems and processes. It is usually created in the testicles. The Leydig cells in the testicles are responsible for generating testosterone. This production is controlled by the brain, especially the hypothalamus and the pituitary gland. When the brain perceives that testosterone levels are low, it sends messages to the testicles to create more. This precise balance ensures that the body has the optimum quantity of testosterone to operate effectively. Testosterone is crucial for guys. It is responsible for the development of masculine physical traits such as facial hair, deep voice, and muscular bulk. During puberty, testosterone levels grow considerably, contributing to the development of these traits. In maturity, testosterone continues to play a key role in maintaining muscle mass, bone density, and overall energy levels. It aids with muscular development, strength, and vitality. Testosterone stimulates protein synthesis, which is needed for muscle development and repair. This is why males with greater testosterone levels frequently have more muscular mass and strength. Additionally, testosterone helps to enhance red blood cell formation, which increases oxygen supply to muscles, enhancing endurance and energy levels. Testosterone also influences your mood and sex desire. It has a tremendous influence on mental health, altering mood, confidence, and general feeling of wellness. Higher levels of testosterone are related with pleasant emotions and enhanced libido. Conversely, low amounts of testosterone may contribute to mood changes, irritation, and a loss in sexual drive. Low testosterone might pose issues. When testosterone levels decline, it may lead to a number of symptoms that damage both physical and mental health. These symptoms may be minor at first but may grow more prominent with time, influencing everyday living and overall quality of life. You can feel fatigued, weak, or sad. Fatigue is one of the most prevalent symptoms of low testosterone. Men with low levels typically report feeling continually fatigued, even after a full night's sleep. This may be accompanied by an overall sensation of weakness and a lack of willingness to participate in physical activity. Depression and mood swings are also prevalent since testosterone plays a role in regulating mood and emotional well-being. You may also have decreased interest in sex. A reduction in libido is a defining indication of low testosterone. Men may discover that they have decreased interest in sexual activities and may face difficulty with sexual performance. This may lead to pressure in relationships and decrease overall quality of life. Low testosterone is prevalent as men become older. Testosterone levels normally fall with aging, commencing around the age of 30. This progressive reduction might lead to the symptoms associated with low testosterone. However, it's crucial to remember that not all men will suffer major symptoms, and the severity might vary greatly. Other health concerns might also cause it. Conditions such as obesity, diabetes, and chronic diseases may lead to low testosterone levels. Certain drugs and therapies, including as chemotherapy, might also impact testosterone production. It's vital to consider these aspects while assessing symptoms and seeking therapy. If you suspect you have low testosterone, go to your doctor. A healthcare expert may undertake tests to examine your testosterone levels and determine whether they are within the normal range. They may also assist uncover any underlying issues that may be leading to low levels and propose suitable therapies. There are therapies that can assist. Testosterone replacement therapy, TRT, is a standard therapy for low testosterone. This treatment includes providing the body with testosterone by injections, patches, gels, or pellets. TRT may help reduce symptoms and enhance quality of life. However, it's vital to examine the possible dangers and advantages with your doctor. This post will examine drugs and therapies that may enhance testosterone levels. In addition to TRT, lifestyle adjustments such as regular exercise, a good diet, and stress management may also assist maintain healthy testosterone levels. By knowing the function of testosterone and the alternatives available, men may take proactive actions to maintain their health and well-being. Testosterone replacement therapy, or TRT, is a medication meant to address low testosterone levels in males. This treatment has attracted substantial interest in recent years because to its potential to enhance the quality of life for persons suffering from the symptoms of low testosterone. It directly boosts testosterone levels in the body, which may help relieve many of the symptoms linked with low testosterone. TRT involves drugs that include testosterone, which may be taken in different ways based on the patient's requirements and preferences. These drugs exist in numerous forms, each with its own set of advantages and drawbacks. You may take them as injections, patches, gels, or pills. Injections are frequently delivered by a healthcare practitioner, whereas gels and patches may be used at home. Tablets provide a handy oral alternative for people who choose not to utilize topical or injectable versions. TRT is useful for men with low testosterone, especially those who have been diagnosed with hypogonadism, a condition when the body does not create enough testosterone. It may help symptoms including weariness, poor sex desire, and sadness. Many men report feeling more energetic, having a greater libido, and experiencing an overall boost in mood and well-being. TRT is a strong therapy that may dramatically boost the quality of life for individuals suffering from low testosterone. However, it is crucial to approach this treatment with a thorough awareness of its possible advantages and hazards. You need a prescription from a doctor to begin TRT. This ensures that the medication is suitable for your unique illness and that you are monitored for any possible negative effects. TRT is not for everyone. It is vital to have a full conversation with your healthcare physician to evaluate whether this treatment is good for you. It may have negative effects include acne, sleep apnea, and an increased risk of cardiovascular disorders. Your doctor will share these possible dangers with you and help you assess them against the advantages of the therapy. Your doctor will follow you constantly during the therapy procedure. Regular blood tests will be undertaken to confirm that your testosterone levels are within the target range and to monitor for any undesirable effects. They will alter the dose as required to guarantee optimum outcomes and minimize adverse effects. This tailored strategy helps to optimize the advantages of TRT while decreasing the risk of problems. TRT may be a useful alternative for certain men, especially those who have not experienced relief from conventional therapies. It provides a tailored approach to managing the symptoms of low testosterone and may lead to considerable improvements in quality of life. Talk to your doctor to discover whether it's suitable for you. They can offer you with thorough information on the treatment, help you understand the possible advantages and dangers, and assist you through the process of beginning and maintaining TRT. By working together with your healthcare physician, you can make an educated choice about whether this therapy is the right option for you. Clomiphene citrate is a medicine that has been extensively utilized for many medicinal uses. Originally intended to treat infertility in women, it has found a vital function in treating low testosterone levels in males. This drug is especially good for individuals who are searching for a less intrusive solution to enhance their testosterone levels without turning to more harsh therapies. It boosts testosterone synthesis in the body by interacting with the hormonal circuits that govern this vital hormone. When taken as recommended, clomiphene citrate may successfully raise the body's natural capacity to create testosterone, resulting to greater energy levels, better mood, and overall enhanced well-being. It works by inhibiting the effects of estrogen in the brain. Estrogen, while generally identified with feminine hormones, also has a function in the male body. By suppressing estrogen's activity, clomiphene citrate fools the brain into believing that there is a deficit of testosterone, causing the body to manufacture more of it. This technique is especially successful in males whose low testosterone levels are related to hormonal abnormalities rather than testicular failure. This prompts the body to generate more testosterone, which may have a range of good consequences. Increased testosterone levels may contribute to greater muscular growth, better libido, enhanced cognitive function, and an overall feeling of vigor. For many guys, this may be life-altering, bringing a newfound feeling of vitality and purpose. Clomiphene citrate is taken orally, making it a practical alternative for many. It is normally taken for a few months, during which time the patient is evaluated to assess the efficacy and alter the dose if required. The oral administration of this drug is a considerable benefit, since it eliminates the need for injections or other more intrusive ways of hormone replacement treatment. Clomiphene citrate is less intrusive than standard testosterone replacement treatment, TRT. While TRT includes frequent injections or topical treatments, clomiphene citrate helps your body create its own testosterone. This natural method might be more enticing to people who choose to forgo synthetic hormones and the possible difficulties connected with them. It is typically safe for most males. However, like other drugs, it might produce negative effects. These adverse effects are typically moderate and controllable, but it is vital to be aware of them. Common side effects include mood changes, headaches, and even vision abnormalities. It is vital to discuss these possible side effects with your healthcare professional to ensure that you are completely informed before beginning the therapy. These include mood swings and headaches, which may be irritating, but are normally transitory. If you suffer any severe or persistent adverse effects, it is crucial to contact your doctor immediately. They may give assistance on how to manage these symptoms or change your treatment plan if required. Talk to your doctor to determine whether clomiphene citrate is a viable choice for you. Your healthcare professional will assess your general health, medical history, and individual requirements before prescribing this therapy. They will also monitor your progress during the therapy to ensure that it is operating successfully and safely. By working together with your doctor, you may obtain the best potential results and enhance your quality of life via the careful control of your testosterone levels. Human chorionic gonadotropin, or HCG, is a hormone. It is normally created during pregnancy. HCG may also be used to enhance testosterone in males. It works by stimulating the testicles to create testosterone. HCG is commonly administered as an injection. HCG is commonly used in tandem with TRT. It helps preserve testicular size and function. HCG may also be taken alone. However, it may not be as effective as TRT. HCG may potentially induce negative effects. This includes acne and mood changes. Looking for high-quality supplements backed by Dr. Andrew Huberman himself? Check out the links in the description below and subscribe and hit the bell icon if you've learned anything new or anything of value.